Hello everyone, welcome back to my channel. My name is Makisa and I'm a mental health as well as marriage and family counselor. On this channel you will receive tips on how to maintain optimum mental health. Today we're going to talk about how to go about obtaining the right level of mental health treatment that's best for you. When it comes to seeking mental health care, selecting the correct level of treatment can have a significant impact in terms of your overall treatment outcome. It can make the difference between having a successful overall treatment experience or having a poor or less than favorable treatment experience. You and or your provider can together determine which level of care best fits you. The different types of treatment include: you have individual therapy. This is basically where you meet once a week with your therapist. You can meet in person or you can meet via telehealth, which is meeting online. The initial session is usually about 60 minutes and any subsequent sessions are about 45 to 50 minutes long. The length of treatment really depends on the symptoms that you're having and in terms of when you achieve your overall treatment goal. Group therapy. This entails meeting with a group of individuals, anywhere from 2 to 10 group members or more in a group setting. Group therapy can be helpful because you're in an environment with other people who are going through similar circumstances. They get how you're feeling. You don't have to explain why you feel a certain way. There's a level of support that's offered in group therapy that you can't necessarily get in one-on-one individual therapy. A group may be open or closed. So if it's closed, you'll be seeing the same individuals each time that you meet. If it's an open group, you may be seeing different individuals each time that you meet. The whole goal of group therapy is to lend support and also to receive support from the group members. There's also meeting with a private provider. So you can meet with a private provider for individual therapy, or you can go to an outpatient behavioral health clinic. An outpatient behavioral health clinic is like a one-stop shop. That's where you can get all of your services at the same location, which can be very convenient for a lot of people. So there you can get your individual therapy. They may also offer something that's called core services. Now keep in mind these services may be different depending on which state or country you live in. So core services is when you get in-home services. You're meeting with your therapist in-home. And this may be convenient. Sometimes people are able to better open up, and talk with the therapist when they're in a setting that's familiar to them, such as their home. So that's core services, basically having in-home services. You also have the option of going into the office for treatment as well if you're getting services through an outpatient behavioral health clinic. Another service that's offered in an outpatient behavioral health clinic is called IFE services. This is for individuals 17 and under, and it's basically intensive services. So meeting once a week may not be sufficient to decrease the symptoms that you may be having. With IFE services, your providers meet with you 2 to 3 times a week, which consists of a treatment team consisting of your therapist and a community support individual. They may meet with you at home, at school, or in the community. They may meet with you also when there's a crisis. And the whole goal of this service is to help stabilize you and prevent you from needing to go inpatient for treatment. Another level of service offered at an outpatient behavioral health clinic is called ACT services. This is basically intensive outpatient treatment for adults 18 and older. With ACT services, you have a treatment team as well, consisting of a therapist and a community support individual. They work with you at your home. They may come to your job. They work with you in the community, meeting with you 2 to 3 times a week or when there's a crisis, basically trying to stabilize your mental health and to prevent you from having to go in an inpatient setting. Now, these services, your ACT services, your IFE services, you have to meet criteria. And so if you go into the outpatient behavioral health clinic, they'll do an assessment to determine which is the appropriate level of care to meet your needs. Another service offered at an outpatient behavioral health clinic is case management services. And this can be great. This is an added services which may include linkage to housing resources, linkage to job resources, really helping in terms of the transportation, getting to and from your mental health appointments. This can be a beneficial services because these are things that may also be needed that may significantly impact your mental health. And so having someone such as a case manager to assist in those areas can really work towards improving and maintaining good mental health. Another service sometimes offered at an outpatient behavioral health clinic is a day treatment program. This may be for individuals who are unable to work due to their chronic mental health condition. You may be receiving disability. A day treatment program is excellent because these programs are geared towards maintaining optimal mental health. And so you're doing things during the daytime that's keeping you productive and active, as opposed to having nothing to do all day, which is really not conducive to good mental health. So these programs are geared towards supporting your mental health and making you feel productive and giving you something to look forward to. That's a major component of having good mental health. These day programs can give you a sense of purpose if you're unable to work due to your chronic mental health conditions. So again, seeking services through your outpatient behavioral health clinic, in your community can be very beneficial to maintaining good mental health. IOP, which means intensive outpatient treatment. This service is usually connected with a hospital. With IOP, it's generally offered Monday through Friday, 9 a.m. until 12 in the afternoon. With this service, you're doing intense group therapy all day. Generally, IOP is for about 2 to 3 weeks. The mental health hospital will really determine the length of program and or your insurance. IOP is great for people that are having moderate mental health symptoms where meeting once a week is just not sufficient to really help stabilize them. PHP, which is Partial Hospitalization Program. This is also a program that's connected to a mental health hospital. PHP is anywhere from 21 to 28 days long, Monday through Friday, sometimes it's Monday through Saturday, from 8 a.m. to 2 or 3 in the afternoon. During this time, you're meeting with your psychiatrist, you may meet with an individual therapist, you do art therapy as well as intensive group therapy. The whole goal of PHP is to stabilize your mental health and to prevent you from therefore having to go inpatient. Your insurance carrier will determine the length of treatment for PHP. Now for PHP and IOP, you can also pay out of pocket if you choose to do so as well. You have to meet criteria for these programs, and the way to do that, you can actually go in person to the hospital that provides IOP or PHP. They will do a face-to-face assessment and determine which level of care is right for you. Sometimes you can also go online with the hospital, and you can also fill out an assessment online, and typically they'll get back with you within 24 hours in terms of whether or not you meet criteria. Next, we have inpatient psychiatric setting. This is acute stabilization. This is for people that are suicidal, they have a plan, they have intent, they're homicidal, which is having thoughts of hurting others, they're experiencing psychosis, and they are unable to care for themselves. When you go to inpatient psychiatric treatment, it can be on a voluntary basis, meaning you are choosing to go on your own, or it can be involuntary. That means a medical professional has deemed that you are a danger to yourself, you're a danger to others, or you're experiencing psychosis to the degree where you are unable to care for yourself. Treatment time could be anywhere from 4 to 5 days. It's a minimum of 3 days if you're involuntary. However, generally they'll keep you until it's safe for you to be discharged. When you're discharged, the goal is that you're safe. The goal is that you can be productive and you can resume your day-to-day activities. Inpatient psychiatric treating may also be for individuals who are using drugs or alcohol, and the level to which they are using endangers them or endangers others. So in that case, they may also be admitted to an inpatient psychiatric setting on an involuntary basis. If you're experiencing drug or alcohol issues, you can also go to an inpatient psychiatric setting on a voluntary basis for treatment for your drug or alcohol symptoms. We have residential treatment. This is for people where they've tried the lower levels of care and it is just not working. They're still having chronic mental health symptoms. They may be getting worse. They cannot be maintained in the home. They're in and out to hospitals. This type of individual may be more appropriate for residential. Now for residential, you have to meet criteria. It has to be proven, documented, that those lower levels of care have been utilized and they've been proven to be unsuccessful. The insurance company has to approve for residential treatment. You may or may not be able to self-pay as well for residential, but again, an assessment has to be done face-to-face, and the residential facility will determine whether or not you meet criteria for that service. Residential treatment is usually 30 days plus. So it can be 3 months, 6 months, 9 months. There's different lengths of treatment periods depending on the severity of symptoms that you have. Again, the goal of residential treatment is for you to be stabilized so you can return to your home and your community, and you can utilize and return back to your normal day-to-day activities. And when you're discharged from residential, you can then step down to a lower level of care, such as individual therapy, whether it's through a private provider or whether it's through an outpatient behavioral health clinic. Again, in order to access these services, you can go online and find information directly through those hospitals or facilities. You can also contact your local crisis line. So whatever state or country you live in, you should have a mental health crisis line that you can call to inquire about these services, and they can point you in the right direction. If you are experiencing a mental health crisis, you can also go to your local hospital emergency department. Let them know that you want a mental health evaluation. The doctor will order one. A mental health provider will do an evaluation and then determine which level of care is best for you, whether that's inpatient, PHP, IOP, or traditional therapy and or medication management through a psychiatrist. So that's another option that's available to you. You can also go through your insurance company and inquire about these different services, and they can also point you in the right direction. Hopefully the information provided can serve as a guide and point you in the right direction in terms of selecting the right mental health treatment for your needs. Keep in mind that different things work for different people. There's not a one-size-fits-all model. Your treatment is tailored to your individual needs. When seeking mental health treatment, it's so important to utilize your village, your support network. People that have support, for the most part, fare better in terms of treating their mental health than people that don't have any support or limited support. Seeking mental health treatment can be scary. It can be confusing. There's so many things that you may not know or you may have questions about. So having a trusted support network that can help you in making those decisions can be very beneficial. So don't be afraid to reach out to your village or your support system. That's all I have for today. If this video has been beneficial to you, please go ahead and hit that like and subscribe button, and please share with others. Until next time, please be well.